This is a case of presternal keloid in a young male patient. Patients having history of 17 times intralesional triamcinolone injection taken outside. Now we plan for excision of this keloid and followed by the coverage with the full thickness skin graft. After excision, the lesion can be seen and the excised specimen seen outside. And now we are planning for full thickness skin graft harvesting from the right lower transverse abdominal crease, lateral 1/3 non-hair bearing area, and you can see the full thickness skin graft has been harvested and it is now being applied over the defect or recipient area with the help of the 3,0-ethylone or polyamide, and now we are suturing it in such a way so that the proper stretching of the full thickness skin graft can be achieved and proper fitment with the recipient site can be appreciated, and sometimes it is very difficult to treat a keloid. Earlier it was depicted that the intralesional excision is preferable, but now it is recommended that the total excision of the lesion is recommended, and there is multimodality of treatment is there. And now in these patients or for such presternal keloid, it is always advisable and recommended the algorithm of the keloid treatment or hypertrophic scar treatment is excision followed by coverage. You may cover it with the flap also, like jet plastic, multiple jet plastic, and or full thickness skin graft. Here we use the full thickness skin graft, and our planning is after fixation and the graft tech, we will apply the fludrocortisone tip, or in such a case you may use the injection triamcinolone, and in these patients I am planning for 3 post-operative doses of triamcinolone at 3 weeks interval, followed by the pressure tip with the fludrocortisone. It's an steroid tape, or after use this steroid tape, the keloid will reduce, the inflammatory condition will be ceased, and the keloid turned into a normal scar tissue, and the wound will be very much healthy. Or in such cases, after 3 doses of the triamcinolone injection, I would prefer to use here the low dose electron beam therapy 18 CGI, that has to be given in 3 fractionated doses on 3 consecutive days, and the results will be very good. And whether the electron beam therapy is not available, in that case you may use the dipropionate or fludrocortisone tip for the compression, and the keloid's recurrence rate is dramatically reduced. So in my plan I will give 3 doses of triamcinolone injection post-operatively at 21 days apart, followed by low dose electron beam therapy in 3 fractionated doses on 3 consecutive days, and that's all. And here after taking the graft, the donor site is closed primarily with 3,0 vicryl in an inner layer. It is a 2-layered closure, and inner layer is closed with the 3,0 vicryl and outer layer will be closed with 3,0-ethylone in an interrupted manner. And the recipient side, the full thickness skin graft that has been applied, that has to be bolster dressing uh, will be applied later on after closure of this donor defect. We will cover it the bolster dressing, and this bolster dressing will help for the proper attachment of the graft, because during the respiration the chest movement, the chest expansion will hinder the graft tech at the recipient side. That is why we will prefer to use the bolster dressing over the presternal area or chest or abdomen where it is indicated, where the movement or respiratory movement will hinder the surface attachment in between the undersurface of the graft and the donor recipient side. The primary closure of the donor side, the second layer, that is the with the 3,0 ethylone is going on, and it is an interrupted simple suture is given. So it is almost completed now. You can see the nice scar that will be linear one, it will develop later on. So it's over almost, and the donor side dressing only with the ointment and gauze is there, and the linear scar will help post-operative good outcome of these patients. And you can see the depicted site of the graft to take from the lower transabdominal piece after bolster dressing. The recipient area is looked like that. It is only the horizontal